Good morning, Sidney, and welcome to Sidney Chatter Box, and I'm Jeff. As we all know, I've been here quite a bit now, so today we're talking about migraines. What is a migraine? What is a migraine? A lot of people suffer from migraines. I know I have 2 young children that do, and they're very hard migraines that make them sleep, make them tired. So we're going to get into the show. What is migraine? A migraine is a relatively common medical condition that can severely affect the quality of life and his or her family and friends. Almost 8% over the age of 12 have been diagnosed with migraines, of which 75% are women and 25% are men. Migraines most commonly experienced by both men and women between the age of 25 and 39. There are 2 different types of migraines. Migraines without an aura, and a migraine with an aura, which is a little black spot that you see out of the corner of your eye. A migraine without an aura is a condition characterized by moderate to severe throbbing and unilateral pain. The pain is worsened by movement and accompanied by at least one of the following symptoms: nausea, increased sensitivity to light, increase of sensitivity to sound. Migraines without an aura involves any number of different sensations that range from visual disturbance to physical sensations. The symptoms usually occur in alternating body sites during different attacks. Almost always a feeling of strangeness a day or 2 before the attack begins. Characterized by mood change, food cravings, feeling tired, excessive yawning. Some people may also experience fatigue, stiffness in the neck, or difficulty concentrating. What causes a migraine? Causes a migraine, there are many theories discussed that cause migraines. The cortical spreading depression, CSD theory, suggests that migraine is a disease of the brain, such as a angina is a disease of the heart. Disrupting of normal brain functioning is believed to be the underlying cause of the migraine pain. Another theory is vascular theory, which suggests that the migraines result from blood vessels surrounding the brain. The chemical is also thought to play an important role in migraine development. The cause of migraines have remain unknown. A number of potential migraine triggers, habits, or conditions associated with the onset of a migraine have been identified. So we're going to go on here. Each migraine sufferer has his or her individual triggers. Many migraine in women are triggered by hormonal changes, such as those experienced during menstrual and pregnancy. Up to 50% of women can suffer from a migraine related to menstruation. Migraines tend to intensify during and disappear during menopause. Migraine could be triggered by a diet, strong odors, bright lights, loud noise, changes in the weather, stress, sleeping more or less than usual, and certain medications. So you have to be careful what medications you take if you are suffering from migraines. Make sure you check with your doctor. We're going to let them know that you suffer from migraines before they put you on any new medication. Although an estimate 2 million have been diagnosed with migraines, only 1 in every 12 migraine case has been diagnosed. It is important to talk to your doctor if you believe that you suffer from migraines, because this condition can be managed and treated. In migraines without an aura, diagnosis includes, it's the cutoff of your sight off of one side, untreated or unsuccessfully treated attack lasting 4 to 72 hours. The attack has at least 2 of the following characteristics: isolation of pain to one side of the head, pain of pulsating quality. It's like you're feeling your heartbeat pounding in your head. Moderate to severe pain intensity, several of pain or prohibiting daily activities. During at least one attack, the following symptoms should be present: nausea and vomiting, sensitivity to light, noise, and odors. At least 2 attacks of symptom. Many include visual disturbance, such as seeing spots or unusual colors, lasting a minimum of 5 to 20 minutes and a maximum of 60 minutes. A headache with characteristics associated with the migraine without the aura, beginning during the aura or within 60 minutes following the aura. Okay, here's a couple of ways of managing your migraines. First step to your migraine is to identify your triggers so that you can avoid them in the future. You may find it helpful to keep a migraine diary to track the details of your attacks. Immediately after an attack, ask yourself these questions. How severe was my migraine? 1, 2, or 3. 1 being mild and 3 being severe. Was it accompanied by the aura? Did you experience any of the symptoms? Nausea, light sensitivity, and sound sensitivity, which are the number 3. What medications did you take? Did you relieve your pain? Did they allow you to return to daily activity? What do you suspect your migraine triggers are? After every attack, write your answer in a migraine diary. That's a very good thing to keep, as a migraine diary. Compare answers to see if a pattern emerges and identifies your triggers. Alright, so a diary is a very good thing to keep. It'll keep track of how many migraines you've had per week. Also keep track of your food that you've eaten, any medications that you've taken, and you'll be able to identify any of those problems. Alright, treating your migraine. Common non-prescription painkillers such as ibuprofen can be effective to a mild attack if taken early. Prescription medications may also be used treating migraines, including a non-specific and specific therapies. What else can I do to manage my migraines? Okay, there are various things you can do to help reduce the risk of an attack. Like I said, very important to keep it a diary. Okay, is very important. Eat and drink regularly. Follow a regular sleep routine. Exercise. Reduce stress. Avoid overstimulation of senses. Stop smoking. Behavioral, psychological support, and physical therapy. Migraines, like I said, I have 2 daughters that suffer from migraines. It's very important, though, that you actually keep a diary, write down all the foods that you have eaten, any medications that you have taken, because medications and foods can cause an onset to a migraine. Sleeping too much can cause an onset to a migraine. Not getting enough sleep can cause an onset to a migraine. Today on the show, I'm offering a free ebook. Again, it's free. All you do is email me at Sidney Chatter Box at gmail.com. I will send you out What is Migraines? This is a book that will explain everything that I just went over, plus a few more things that, of course, are a little more technical than I can handle. So, but if you email me, I will send you this book. It's free. It'll come in as a PDF file in your email, and you load it to your computer and you can read it. So I hope everybody takes advantage of the free ebooks that I offer. They're full of a lot of information if it's something that you suffer from. The other thing I'd like to touch base with is our next show. We're going to do a touchback. I'm going to call it touchback. It's I don't know if everybody had seen the video that I made this week with the mess being on River Street. We had a young lady in our community go down there and clean it up, took care of it. She contacted the landlord of the building. The landlord